Hi, everyone. This is Kate Warnock coming to you from the GuideWell UST Global Innovation Center with a very special guest, Dr. David Whitehouse. Dr. Whitehouse, welcome to the interview.
Thank you, Kate.
So Dr. Whitehouse is the Chief Medical Officer for UST Global. So Dr. Whitehouse, here we are in the middle of this amazing building, and I was hoping you could tell us, why was GuideWell the right partner for UST Global?
Well, there are multiple reasons, but this is such a unique opportunity. There are lots of health incubators starting up in various cities around the United States. There are health innovation centers. But there are no innovation centers that are in medical innovation cities where there is a complete ecosystem. And why is that important? It's important because in digital healthcare, of all things, there needs to be the ability to pollinize across multiple different silos of industry, to learn about financing from banking and what they've done well, or retail, to learn from consumer engagement from a variety of people, from artists and aesthetics about how to design solutions that are meaningful to people. And the other thing is an iterative design, where you need to test it, break it, rebuild it, start again. And the people who are going to be the end users have to inform your success. This was the complete set of ecosystem users, providers, consumers, research centers, pharmacists, pharmacy researchers, academic centers. The whole ecosystem of healthcare was here. And such an atmosphere of cooperation. I think it was that GuideWell had reached out to us, and it just felt like such a family experience that it was an opportunity, a unique situation, and it's always the people that finally sell it to you. So that makes it really worthwhile.
Right. Well, what a lovely response. You know, Doctor, when you were talking in our grand opening event that we had today, you really did mention, and you mentioned it just again, how important it is to pay attention to the disruptors that are in the other industries. What is it that you think you see being applied, or what will be applied from those other industries that will really move the health experience forward the most?
There's a statement in digital that what has become your best experience in any industry becomes your expectation of every industry. So if I've experienced it in the transportation world in Uber, and it's changed my experience and it's become easy, I can get transportation in the middle of a rainstorm and it's bright and attractive and it's prepaid, and I say, that just feels good and feels right. Then I try to go to a hospital, I wait in lines, no one has my information, I repeat it endlessly to different people. As for billing, whether I've got a copay or a co-insurance, and I don't even understand the terminology, and what was left on my HRA, or was it an HSA from last year, and which one of those two rolled over? No, there is nothing about healthcare. So we have multiple industries we can learn from. We have such a long way to go. It doesn't matter where we start.
Well, so given that, Doctor, are there particular challenges within the health industry that you would like to see really tackled here with GuideWell Innovation?
Yes, I think two of them at the moment that we're facing kind of nationally, which there has been some movement are, we have to get over the one negative thing of the entrepreneurial spirit, which is, I made it, I own it, and nobody else can have it, which led to the interoperability crisis. You need to have the capacity to be able to share your data. We are very behind a concept which is much broader in Europe, which is that the patient truly owns their own data. Here, health plans own your data, other people own your data, but do you have a solid repository of your longitudinal health record easily available? That should happen almost immediately. That would be so important. You can't be responsible for what you don't fully know or have a record of. And none of us has a good memory. If I asked you, do you remember what your vaccinations were as a child? You would look at me and say, haven't got a clue. Is it actually important? Yes, it's actually very important, but you don't remember. So I think interoperability, longitudinal health record would be essential. And then the other is care coordination, which is the ability that to see health as something which is about the whole person. It is that your health is about expertise all the way down to the genetic level if you have some disease like cancer. But understanding if you're a child and it's about malnutrition, that it may be about social circumstances and the ability to purchase food. And so from the complete macro level down to the micro level, an ability to understand that the solution requires the movement of many pieces working together, and that we should be able to facilitate that through technology, that the movement of knowledge, the movement of support, of guidance, whether it be in telemedicine, can be made so much easier to create a blanket of care around a person, around a situation, around a community.
Well, what a lovely response, and I think that we're very fortunate to be family members now with UST Global. So, Dr. David Whitehouse, thank you so much for joining us.
We're thrilled. We're absolutely thrilled. Thank you, Kate.
Well, thank you. My name is Kate Warnock. Thank you so much for watching.